Hello, my name is David Trimberger. This is Molly Hall, and we are now doing my peer-to-peer attempt number 4 for trauma adult physical assessment. Where am I being dispatched?
You're being dispatched a 20-year-old male with a 20-year-old male assault with an injury.
Assault with injury. Okay. Starting off, what is the credentials of my partner?
EMT.
EMT. Where's my nearest level 1 hospital?
15 minutes away.
Okay. Has police already been dispatched to the scene?
Yep.
Okay. What time of day is it?
Around dinner time.
Okay. Where am I being dispatched to?
College cafeteria.
College cafeteria. And then what's the weather like outside? Sunny. And then with the police on scene, I'm going to go ahead and stage until police will allow me to be on scene. Is police going to allow me on scene?
Yep, they've already caught the perpetrator.
Sounds good. So as I approach my patient, what is my patient presentation?
He's standing clutching his arm. No obvious signs of bleeding, but you notice a deformity to the extremity.
Okay. And so then here we go. BSI, is my scene safe?
Yep.
Okay. Going to go up to my patient. Does my patient look at me whenever I approach him?
Yes.
Okay. So going up to my patient. Hey man, my name's David. I'm with Whatever EMS. What happened today?
I was getting into an argument with my friend when he just started getting really angry, and next thing I know, he broke my arm.
Well, that's kind of a sucky friend. Sorry that happened.
Mm-hmm. Over a girl, too.
It was over a girl, too. Whew, girl troubles. That's a fun day. All right, well, do you feel any pain anywhere? Is it just within the arm?
Just within the arm, but it hurts.
But it really hurts? Okay. Well, a couple questions I got to ask you before we kind of get out of here. Do you know where you're at right now?
College campus.
You're at the college campus? Okay, do you know what the day is?
The day after the 4th of July.
Okay. Do you know who the president is? Trump. And then if you had 4 quarters, how much money would you have? $1. Okay. Would you mind opening up your mouth? I'm going to inspect your oral airway. Okay, is my airway clear?
Yep.
Okay, going to assess his breathing pattern. Is his breathing pattern clear? Normal. Okay. And then I'm going to check a carotid pulse. Is it present?
Yep.
Okay. Do I notice any other obvious signs of deformities or bleeding to any other spots on his body besides just his arm?
Mm-hmm.
Okay. So I'm going to go ahead and try and get my patient out of the environment. So, hey man, I definitely think you need to be going to the hospital. Wouldn't you agree?
Yep.
Okay, what hospital do you want to go to?
OU.
OU? Okay. So, do you think you'd be able to walk to my stretcher and we can get you to the ambulance?
Mm-hmm.
All right. So I'll go ahead and get my patient to the back of the ambulance. As I'm doing that, I'm going to be doing 3 things at the same time. I'm going to be instructing my EMT partner to go ahead and connect my patient to the monitor. So I'm going to be looking for a heart rate, respiratory rate, SpO2, blood glucose, and go ahead and connect them to a 4 lead. And I'll also be trying to assess for a pain scale. And then I'm also going to be trying to obtain a sample history and a rapid head-to-toe. So starting from the top with my partner, what is his heart rate?
78.
78. What's his blood glucose?
75.
75. What's his respiratory rate?
14.
14. What's his blood pressure?
120/78.
Okay, and then what's his SpO2?
97.
97? Okay. And then, hey man, on a scale from 1 to 10, 1 being no pain at all, 10 being worst pain you've ever felt, how do you feel?
About an 8.
About an 8 out of 10? Okay. And you're just feeling pain in that one area? Does it stay in that one spot, move anywhere else?
Right now, it's just in that one spot.
Okay, would you be able to describe that pain to me in your own words?
It's sharp and burning and hurts. It feels like someone took a knife and just
Gotcha. Well, I'm sorry that
stabbing.
Stabbing? Okay. Well, I'm sorry that happened, man. Well, a couple other questions. So, as I'd be talking with my patient, I'm going to be doing my sample history and rapid trauma assessment at the same time, but I'm going to separate them out for the sake of this skill. So starting off, hey man, do you have any allergies to anything?
No.
Do you take any medications?
No.
When's the last time you ate or drank anything?
Like 2 hours ago.
2 hours ago? And then you said you were just kind of like sitting in the cafeteria talking with your friend, and then he just kind of attacked you?
Yep.
Gotcha. Okay. So then as I'd be doing that, I will also be doing my rapid head to toe. So starting at the top of the head, feeling his scalp, going to be assessing for any signs of decap, BTLS. Is there anything present?
Mm-mm.
Okay. Going to go down to his face, check a pupillary reaction. Does he have pearla?
Yep.
Okay. Is his nose in line?
Yes.
Okay. Any damage to the oral cavity?
No.
Okay. Going to check on the ears. Is there any battle signs or drainage from the ears?
Mm-mm.
Okay. I'm going to go down and also assess his throat. Does he have any signs of JVD or tracheal deviation?
Normal.
Normal. Okay. Then I'm going to go down to his chest. Is his sternum in line?
Yes.
Okay. Does he have any crepitus or decap BTLS to the rib cage?
Mm-mm.
Okay. And then I'm also going to auscultate all of his lung fields. Any is there clear equal bilateral lung sounds?
Yep.
Okay. Then I'm also going to go down and palpate his abdomen. I'm going to assess for all 4 quadrants. Good. Okay. Then I'm going to assess his pelvis. Is his pelvis stable?
Yep.
Okay. Now I'm going to also check his back. Is his back clear?
Yep.
Okay. Then I'm going to assess his extremities for pulse motor sensory as well as for any signs of decap BTLS.
Normal except for the right upper extremity.
Right upper extremity. Okay. So now that I have all that information, what I'm going to do is I will have my EMT partner go ahead and stabilize the extremity by holding it in place. I'm going to come over and stabilize the extremity, try and use a SAM splint, keep the arm in a neutral position, and just try and stabilize it as best as I can. Due to my patient being in an 8 out of 10 pain, I am going to give him a pain medication to try and help reduce some of the pain stimuli. So, hey man, have you ever taken any type of pain reliever or anything?
Morphine.
You've taken morphine? Okay. Well, I'm going to be giving you a little bit of fentanyl. Is that okay? It's just kind of like morphine. Is that all right?
Yeah.
Okay, so I am going to have to start an IV on you, so you're going to feel a little prick in your arm. Is that okay?
Sure.
Okay, so I'm going to start an 18 gauge IV in his left extremity. Did I succeed on that?
Mm-hmm.
Okay. After I have started my IV, I'm going to administer 50 micrograms of fentanyl, and then I'm also going to connect my patient to capnography since fentanyl can cause hypovolemia. Then I'm going to continue to monitor my patient every 5 minutes while I'm en route to the hospital. I'm going to go ahead, call report to the hospital, let them know that we are on our way. And then I'm going to continue to monitor my patient. Was there any change in patient condition en route to the hospital?
No.
Okay. Then as we get to the hospital, I will give report at the patient bedside and transfer care to the nursing staff.
Beautiful.
Thank you.